आपके सबके सेमेस्टर एग्जाम्स, टर्म एग्जाम्स चल रहे हैं, बहुत जल्दी प्रॉफ एग्जाम्स भी आने वाले हैं एंड माई DMs आर फ्लडेड विद मैसेजेस सेइंग एग्जामिनर विल instantly think that your mind is also haphazard in that moment. Observation is whatever you're seeing under the microscope. Example, I can see red colored bacilli against a blue colored background. It is very, very easy. The whole gist of the matter is look presentable, be confident, be neat and clean in your surrounding, be ready before the examiner comes to you, and be conscious and aware and answer crisp to the point. Hi everyone, how are you all doing? So आपके सबके सेमेस्टर एग्जाम्स, टर्म एग्जाम्स चल रहे हैं, बहुत जल्दी प्रॉफ एग्जाम्स भी आने वाले हैं एंड माई DMs आर फ्लडेड विद मैसेजेस सेइंग मैम मैंने बहुत अच्छा पढ़ा था, आई वॉज एक्सपेक्टिंग दिस मच मार्क्स बट एग्जामिनर ने मुझे इतने मार्क्स दिए हैं, हाउ टू इम्प्रूव माई सेल्फ. So I am here to tell you how to tackle a examiner in the Viva. ये एक बहुत हॉट टॉपिक है और ये समझते समझते पूरी MBBS खत्म हो जाती है. There are students who read a lot जो बहुत मेहनत करते हैं बट somehow वाइवा में उनके उतने अच्छे मार्क्स नहीं आते और दूसरा उनका फ्रेंड वाइवा में, थ्योरी में बहुत अच्छे मार्क्स ले जाता है. तो I'll tell you, being an examiner, हम लोग कैसे सोचते हैं, एक एग्जामिनर क्या सोच रहा है जब वो आपको असेस करने आया है and how can you crack that code. देखो, whenever एक external examiner या even internal examiner जब आपका एग्जाम लेने आते हैं, they don't know you. They don't know your past, they don't know your yearly performance. They are meeting you for the first time and they're probably going to meet you for 4-5 minutes. They don't care about anything in that moment. They just care what is the first impression that you're going to give the examiner. अगर examiner suppose आपके स्टेशन पे आया है, योर प्रैक्टिकल स्टेशन जहाँ पे आप कल्चर एक्सरसाइज परफॉर्म कर रहे हो, स्टेनिंग एक्सरसाइजेस परफॉर्म कर रहे हो, एंड दैट स्टेशन इज विजिबली haphazard, examiner will instantly think that your mind is also haphazard in that moment because your station is a direct reflection of how calm and composed and confident you are. Secondly, it might sound like a small thing, but the way you present yourself. Is your hair cut neatly? Is your hair tied neatly? Are your nails cut? Is your apron neat and well pressed and ironed? Are you wearing professional clothes? Are you wearing covered shoes? I know all of this sounds quite old school and all of that, but we still have examiners who come from that same school of training. So they were trained in the same way. Now they also expect you to come up in that manner because ultimately you're training to be a doctor, let's face it. And a doctor should always look professional, should always dress appropriately for the profession. So that is the first thing that the examiner sees. I know a lot of us pull all-nighters, we don't sleep the whole night and whatnot. But make sure it doesn't show on your face because an examiner does not like it. Because an exam is mostly like a field trip, field day for the examiners, right? So they come there with a positive mindset to assess you and to pass you. You should also support them in doing that, right? So presentation matters a lot, irrespective of what your seniors or juniors might say or think. Of course, it doesn't mean that you spend a lot of time grooming yourself, just look presentable. Secondly, like I said, your station should be neat and clean. Everything that you're supposed to show this examiner, suppose you're supposed to show a particular slide to the examiner. Most of the times they make an announcement that please focus your Z and stain slides because the examiner is coming soon. Why do they do that? Please understand. Because they want to save their time. They want to save their and your time. They don't want to keep standing on your station waiting for you to focus the slide. So make sure the announcement, whatever has been made, you do that. You focus that. You might be doing some other staining at that point of time. You might be drawing in your answer sheet or something. Stop it right there. Focus your slide at that moment, the slide which is being asked by the examiner to focus. Focus it, find a good, excellent field. Sometimes the students, they overthink, and they focus an area which is difficult just to impress the examiner. Don't do that. Focus the very clear, crisp area. Example, you have a Z and stain slide. Focus that portion of the slide जहाँ पे maximum acid fast bacilli दिख रहे हैं, आपकी slide की सबसे best staining जहाँ पे हुई है. Sometimes because you are new to staining and we don't get that much practice, हमारी slide में some portions are nicely stained, some portions are not so nicely stained. Make sure you focus the nicely stained area with the maximum number of cells visible, the bacteria beautifully visible, all the things that you're writing in the answer sheet clearly readable by the examiner, right? The moment the examiner comes to your seat, they should see that you're ready with the slide, focused, you're ready with the interpretation and observations neatly written in your answer sheet. Observation is whatever you're seeing under the microscope. Example, I can see red colored bacilli against a blue colored background. Interpretation is what you understand from that. Example, I can see acid fast bacilli in modified Zeden stain, morphologically resembling Mycobacterium tuberculosis, right? This is how you write in your answer sheet. Draw a very, very nice diagram. Use colored pencils. Label the diagrams. Do not be lazy about it. Practical exam is the easiest way to get full marks and to increase your score by a lot. So don't lose marks on these things, the easy to get things, right? Same applies to gram stains, same applies to culture stains, same applies to your stool exercises, same applies across subjects, path, pharma, micro, every subject. Even this applies to first year, final year, everybody, right? You have to understand, examiner is not there to fail you. Examiner is trying very hard to pass you. Please support them. And whenever they ask a question, please say direct answers. If you know the answer, say exactly what they have asked. When you try to say too much just to show that you have read too much, examiner has always read more than you, right? Then they will take you on a track of questions that ultimately they will not stop till you stop answering, right? So whatever they have asked, crisp and clear, answer it. If you don't know it, say I cannot recall. I will, I cannot recall. They might give you a chance to go and read, or they might not. That's okay. Secondly, answer in a way, only utter the words you know the further story of. If you will randomly utter out words, the examiner will A, get irritated, and B, they will then take the viva in that direction. So only say the words you want the viva to go in the direction of. This is a very smart trick, and you get a hang of it once you practice and you're sitting in the viva all aware, all conscious, with all your presence in that moment, right? Suppose they start asking you about tuberculosis, and you say gene expert, make sure they're going to ask you the next thing, what type of a test this is. The moment you say CBNAT, the viva might go on to the different types of PCRs, or the viva might go on to what are the different diagnostic methods of tuberculosis. But if in that moment you will utter random words, then the exam will go into that direction. Suppose in that moment you just uttered drug resistant TB, then the whole viva will go to the TB drugs and the NTEP updates, and you will be like, this is not pharma and PSM exam. Why are they asking me this in microbiology? Because you uttered that word, right? So you drive your viva. You are sitting in the driver's seat. Always remember that. So it is very, very easy. The whole gist of the matter is look presentable, be confident, be neat and clean in your surrounding, be ready before the examiner comes to you, and be conscious and aware and answer crisp to the point, okay? And if you're scared or you don't know what to answer, take a moment, breathe, think about it, it will come to you. I promise you, it will come to you right in that moment. You have to trust your brain. And you know what's the best part? That students can now use AI to simulate the examiner. अब एग्जामिनर का माइंडसेट तो आप समझ गए हो. So why not use Gemini to pretend to be like your examiner? You can give Gemini prompts like, cross question me like an external examiner, ask me difficult pathology questions, take my anatomy viva. Or you can just create flashcards or quizzes for MBBS Viva exams. So you can articulate your answers, build your confidence, because AI won't just give you answers. It will analyze your thinking pattern, your speaking pattern, and then you can ask it, analyze my performance and tell me where I lack confidence. Because Viva is an art. It's not just reading. It's about practicing delivering under pressure. And that practice you can do with the help of AI and Gemini. So why not start right now and ask Gemini to be your examiner? Because when you finally face the examiner, you have actually faced him quite a lot of times and you're very, very prepared. So all the best for your exams. For any more tips and tricks, do hit me a comment on my social media and I will surely reply to all of you. All the best. See you soon in class.